A lot of people know about what asthma sounds like. There's a cough, or you can have a wheeze, and you're familiar with it. It's scary when you can't breathe, when you hear your child not being able to breathe. But it's hard to know what's going on inside. And so we have a very simple thing that we use to help you understand what is going on inside your child's lungs, or your lungs if you have asthma. First, I want you to hold up your right hand and make a fist. Okay? Good. Now look through that fist, just like I'm looking right now. Now hold up your hand. I'm going to go sideways. Hold up your hand and blow. And you should at this point be feeling air on the flat of your hand. Now slowly close your fist and tell me what's going on with the air against your hand. There's less of it, isn't it? Yep. That's what goes on when your child has asthma. This fist is like the tubes inside the lungs, the airways. And when children have asthma, or when adults have asthma, those tubes become smaller, so that when you try to push the air out, it's smaller and it's harder to do. It's constricted. So let me explain why that happens. The first thing that happens is when when you get asthma, what's happening, first thing that happens is like the muscles in your fist, you clamp down. That's called bronchospasm. And when the fist closes like that, normally it would relax again. Our airways are always contracting, relaxing, contracting, relaxing, contracting, relaxing. But when you have asthma, that relaxation doesn't happen. They're overreacting to a stimulus out there. They're saying, oh my goodness, and they clamp down to try to get the air out, but they never unclamp. The lungs are clamped shut. What happens then? This is where the quick relief medicine comes in. Some people call it the rescue medicine. Some people just call it the pump. And what the pump does, it's albuterol, Ventolin, Proventil, comes in different names, is you breathe that in, it goes straight to the airways, and it tells the muscles, relax, and it loosens up that spasm. Just like, take your fist, feel it how it opens up. That's what the albuterol, the quick relief medicine is doing. It's opening it up so that the airway you can see through again, just like I'm looking through it. So the quick relief medicine takes that bronchospasm and says, stop spasming, relax. And then it can go back to its normal open, close, as it just normally pushes the air in and out of your lungs. But that's the part one of what happens with asthma. Part two of what happens with asthma is that the airways themselves, your fingers, if you will, picture them getting fat. And they get fat because they are inflamed. You know how when you have a cold and your nose gets runny and it feels like you're stuffed up inside? That is actually what's happening inside your airways. They're getting inflamed just like your nose gets inflamed when you have a cold. And they're getting choked up, they're getting a little bit swollen, and there's a lot of mucus. So that is the second part of asthma. That part of asthma, that is the inflammatory process, is the part that needs to have a different kind of medicine, a different kind of treatment to make sure that we don't get asthma all the time. And that is the part that often has an allergic component. Say you're allergic to dust or to mold or to pollen. Anything that you become sensitive to in the lungs, it's going to cause the lung airways to swell up. And just the clamping down closes down, but it's made worse by the fact that the airways themselves are fat and swollen and they have a lot of mucus in them. So what do we do about that swelling, that inflammation? We use a different kind of medicine. This other kind of medicine is an anti-inflammatory medicine, and it is also called a controller or preventive medicine. And those are the medicines that are taken every day. You take them whether or not you have symptoms. It's like a vitamin. You take the vitamin because it helps your body work better. The controller medicines work the same way. They help your body be a little less ready to react, a little less to jump into that spasm and become inflamed. And by taking a little bit of that controller medicine, it's usually some kind of a corticosteroid product. You take a little of that every day, then when you say your asthma is triggered by cats, the next time you're near a cat, you may be less likely to be triggered by it. Or say you're triggered by pollen. Pollen season comes. If you're not taking the controller medicine, you're going to react much more and much more readily. So the combination of the controller medicine that lessens the swelling inside your airway, and the the quick relief medicine, which stops the bronchospasm, that's how we control asthma. So it's a 1-2. 1, to open up the spasm, and 2, it's always there to make sure that it's not so swollen and the airways are more open all the time.